guys, it's Leah Buckles from Prestige Worldwide Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former CMP examiner. Today, I wanted to come on and discuss anxiety as it relates to tinnitus or tinnitus. Many veterans are service connected for anxiety and many other mental health conditions, and it can be related to your service in several different ways. On a primary basis, if you were diagnosed with anxiety and treated on active duty or any other mental health disorder, and it has continued post-service, that can be service connected on a direct basis if you file a claim. It doesn't mean it will, but more often than not, if you show continuity and you are diagnosed in service, that's something that should be pretty reasonable to service connect. On a secondary basis, mental health disorders can be related to other service-connected disabilities. So today I want to talk about anxiety and tinnitus and how those two topics can be related. So I also want to just throw out a disclaimer that I'm not an accredited claims agent, I'm not a VSO, and I'm not an accredited attorney. I'm not a legal expert. I am a medical expert that reviews files and provides medical opinions based on the files that I have reviewed. Now, these letters are never required. You can also get one from your treating physician or psychologist or whoever's treating you. Also, you can get a free opinion at your CMP exam if you go. Just want to give you guys a couple of pieces of information and literature that I use when I'm discussing this, or one of our psychologists is discussing this. That way you can go take a look, perhaps bring it to your treating physician, and they may or may not agree that this is what's causing your condition. So it's also important to note that if you have other things causing your mental health disorder, it doesn't necessarily have to be tinnitus. If you have a lot of marital discord, if you're having some bereavement issues with the loss of a loved one, or if you have a substance abuse issue, those could more likely be the cause. You can have it could be multifactorial. It could be a pain disorder, or you could have tinnitus causing some of these symptoms. So every case is different, of course. So now when it comes to this condition, there are several pieces of literature that we like to cite, and I want to share some of those with you today. So one of the first ones is called, it's a study published in the International Tinnitus Journal or Tinnitus Journal in 2013 called The Relationship of Perceived Severity of Tinnitus with Depression, Anxiety, Hearing Status, Age, and Gender in Individuals with Tinnitus. And they concluded that due to the strong association between tinnitus, depression, and anxiety, that all tinnitus patients should be screened for psychiatric disorders. Okay, so that's one study. Another one entitled Tinnitus Epidemiology, Prevalence, Severity, Exposures, and Treatment Patterns in the United States. And that study was published in 2016, found that tinnitus symptoms are closely associated with anxiety, depression, shorter sleep duration, and greater workdays missed. Tinnitus patients, published in 2013. Another one, psychological comorbidity in patients with chronic tinnitus, analysis and comparison with chronic pain, asthma, or atopic dermatitis patients detected a high rate, almost half of the cases of psychological disorders occurring in patients with chronic tinnitus. Patients diagnosed with psychological disorders were predominantly affected by affective and anxiety disorders. Lastly, I'll throw one more in here for you guys. International Journal of Tinnitus. Sleep disturbances associated with tinnitus reduced the maximal intensity of tinnitus, explored the impact of sleep disorders assessed in tinnitus patients, and found that half of the tinnitus patients experienced poor sleep quality, and concluded that reduction of the intensity of the tinnitus is essential for improvement of sleep quality and patients' quality of life. So I also see this tinnitus related to insomnia quite often. That's another topic for another day. But these are some of the articles that may be helpful if you want to review them, and of course, take them to your treating provider to discuss the effects. So I don't really, again, I'm not an administrative expert, but I want to touch on the ratings for this. Now, these are always subject to change. So at the time of recording of this video, these are the current mental health ratings, the scale. You can be rated anywhere from 0 to 100% for any mental health disorder. So it just depends on the severity. There's a whole bunch of characteristics that go into each one of them. Generally speaking, 0% is going to be if you have a very mild presentation. Perhaps you have a qualifying diagnosis, but it doesn't really impact you in everyday life. too much, all the way to 100% where you've got total occupational and social impairments, and some other difficulties with emotional and cognitive functioning. So I hope this was helpful. If you guys have some questions regarding anxiety and tinnitus or tinnitus, I'm happy to answer them. Please drop your comments below. If you have any other topics that you'd like to hear about, I'd be glad to hear about them. Please like and subscribe to the channel because I always appreciate the support and trying to get some good information out there. Thanks for watching, and I'll talk to you guys soon.